style questions focused on herpes simplex virus 1, HSV1, with 5 answer choices each, and treatment discussed in the last question. Question 1. Temporal lobe encephalitis. A 30-year-old man is brought to the emergency department due to confusion, fever, and new-onset seizures. CT scan is unremarkable, but MRI shows enhancement in the temporal lobes. CSF analysis reveals elevated protein, normal glucose, and lymphocytic pleocytosis. What is the most likely causative organism? A. Neisseria meningitis, B. Listeria monocytogenes, C. Herpes simplex virus 1, D. Cryptococcus neoformans, E. Mycobacterium tuberculosis, C. Herpes simplex. Explanation. HSV1 is the most common cause of sporadic encephalitis in the U.S. Classic features: fever, seizures, confusion, aphasia, temporal lobe involvement on imaging, and lymphocytic CSF profile with normal glucose. Why not the others? A. N. meningitis, typically shows neutrophilic CSF and purpuric rash. B. Listeria, more common in neonates and immunocompromised. D. Cryptococcus, causes chronic meningitis in HIV/AIDS patients. ETB, shows high protein, low glucose, and basilar meningeal enhancement. Question 2. Herpetic Whitlow. A 25-year-old dental hygienist presents with pain and vesicular lesions on her right index finger. She reports recently treating a patient with a cold sore. Which of the following is the most likely diagnosis? A. Contact dermatitis, B. Herpetic Whitlow, C. Erythema multiforme, D. Impetigo, E. Tinea manuum. Correct answer B. Herpetic Whitlow. Explanation. Herpetic Whitlow is a painful vesicular infection of the fingers caused by HSV1 or HSV2. Common in healthcare workers, dentists, hygienists, due to contact with infected oral secretions. Why not the others? A. Contact dermatitis, usually itchy, not vesicular and painful. C. Erythema multiforme, target-like lesions often on extremities, not localized to finger. D. Impetigo, crusted lesions, usually not vesicles and more common in children. E. Tinea manuum, scaly, not vesicular, caused by dermatophytes. Question 3. HSV1 reactivation and treatment. A 40-year-old man with a history of cold sores presents with multiple vesicular lesions on the lips. He notes that this occurs often during times of stress. Which of the following statements is correct regarding the causative agent and appropriate treatment? A. Virus remains latent in the dorsal root ganglia. Treat with penicillin. B. Virus remains latent in the trigeminal ganglia. Treat with acyclovir. C. Virus causes a latent infection in the liver. Treat with valganciclovir D. Virus is RNA-based and causes hemorrhagic vesicles. Treat with ribavirin E. Virus is eradicated after primary infection. No treatment required. Correct answer, B. Virus remains latent in the geminal ganglia. Explanation. HSV1 establishes latency in trigeminal ganglia and reactivates during stress or illness, causing herpes labialis, cold sores. Treatment, acyclovir, valacyclovir, or famciclovir can shorten the duration and severity of outbreaks. Why not the others? A. Dorsal root ganglia, true for VZV, not HSV1. C. HSV1 is not latent in liver. Valganciclovir is used for CMV. D. HSV1 is a DNA virus, not RNA. Ribavirin is for RSV, hepatitis C. E. HSV1 is not eradicated, remains latent for life. Let me know if you